Hi everyone, I'm Dr. Brandi Moore and welcome back to my channel. This video that you've stumbled upon is an episode of Health Talk Tuesday where I answer your pressing health questions. These questions are submitted to me down in the comment section or over on my Instagram. I then place them here in this bowl. I mix them up, I select a question, and I answer it on the spot. I will be doing that today. Every video has about 3 questions that get answered, sometimes more if I'm feeling extra saucy. And let's go ahead and get started. Ooh, what I was forgetting. Disclaimer. This is not meant to diagnose or treat anyone's illness. This video is meant for educational purposes only. I am a doctor, but I am not your doctor. So if you have specific questions, go to your healthcare provider. Okay, so let's get started. Question number 1. Let's select it out of the bowl. What are some symptoms of an underactive thyroid? So underactive thyroid is diagnosed as hypothyroidism, and this is just when the thyroid, which is located here in the neck, is no longer producing an optimal amount of thyroid hormone. Now, once you're out of range, then typically you will be treated with a medication. However, how do you know if you need to even have your thyroid tested? Some common symptoms are fatigue, cold intolerance, which just means if everyone else in the room is feeling like the temperature's perfect, you are always cold. You are that one person that in any given situation is freezing. That would be cold intolerance. Constipation, dry hair, dry skin. Those are a few of, I would say, the most common symptoms that I see across the board. There can be some others, but I would say those are the ones I see the most. Let's get question number 2 on deck. I lost a question overboard. Fell on the ground. Okay, top fertility tips. So, fertility is something that I do often because I help to balance hormones. And obviously you have to have balanced hormones and a normal cycle in order to conceive. So what is my top fertility tip, you ask? It is to track your cycles. Track your cycles. I don't know why no one tracks their cycles or people feel like they don't have to, but it can tell me as a practitioner so much information about what is going on with your hormones if you have your cycle tracked. So you can use apps like Clue, Period Tracker, Flow is another one. There are tons of period tracker apps on your Apple store or your Android store. Select one of them, enter in your period, and track it every single month. It basically teaches you how to track it, right? So day 1 of your period, you enter that in. The next day 1 of your period, which is the first day that you bleed, you enter that in. What that allows us to do is see if the day 1 to day 1 is too short, day 1 to day 1 is too long, maybe you're only bleeding for 2 days, maybe you're bleeding for 10 days. All of these things are abnormal, can be abnormal, and can show us that there's an issue with the hormones that need to be balanced. Another reason why my number 1 fertility tip is track your cycle is because you need to know when you ovulate. There is one time a month. I'm gonna take a pause. I'm gonna repeat what I just said. There is one time a month where you can get pregnant. I know. The entire time you were raised, you thought just a boy looking at you was gonna get you pregnant. And reality is there is one time a month you can get pregnant. Now, maybe you happen to be one of those people that had sex during that one time, and I'll kind of explain why that tends to happen, but one time. So if you are having sex at the wrong time during your cycle, it can lead to either a delay in becoming pregnant or you feeling like you're infertile. And I've had this happen to patients of mine where they were having sex all day, every day, and after months and months and months of trying, sometimes even years, they still weren't getting pregnant and didn't know why. And I gave them this tip to track your cycles and to track your ovulation, and the first month they did that, they got pregnant. So timing is everything when it comes to fertility, and you need to know when that one time a month is. And if you're not tracking your cycles, then you don't know. You have no idea when you ovulate. Now, there are other things to tracking ovulation that I can get to in a separate video since that was not in the question. But in general, track your cycles and track your ovulation. Those would be my top fertility tips, and those kind of go hand in hand because without one, you don't have the other. And now, if you track those and you start to notice changes, then I would reach out to your doctor and see what else you can do, because what is the point of trying to get pregnant or going through the motions and it turns out you're just doing it at the wrong time? or your cycles were irregular and it was going to be really hard for you to get pregnant. Now you've waited a year or two, sometimes 3 years, and IVF is the route that you wind up going because that clock is ticking in a way. So anyways, track your cycles, track your ovulation. That's my top fertility tips. We still have a little bit of time, so I'm gonna add in a fourth bonus question. This doesn't happen all the time, but it happens kind of when I feel like it, when I'm feeling extra chatty. What are some non-hormonal birth control options? Wow, really hit the opposite end of the spectrum here. How to get pregnant, how not to get pregnant. Anyways, the two forms of well, there's a few forms. I'm gonna take the two back. So the forms of non-hormonal birth control would be condoms, as we all know. Then there is the IUD. So an IUD, there's two types. There's a hormonal one called the Mirena, and then there's a non-hormonal one called the Paragard. The Paragard is made from copper, and the copper makes the uterus an inhospitable place for the egg to live, basically. So it prevents the egg from implanting into the uterus. Those two would be, I guess, the top non-hormonal options. There's also things like natural family planning, where you track a combination of symptoms or combination of signs that your body gives you over the month to know exactly when you ovulate so that you can avoid having unprotected sex during the time of ovulation. So you track things like your temperature, your cervical mucus, the position of your cervix, and ovulation, and you can do that with ovulation strips, or the physical signs that I just mentioned. And the idea is you know when exactly you ovulate, so you avoid unprotected sex during that time. So during that time you would use one of the other barrier methods, like a condom, to prevent pregnancy then. There's also things like a diaphragm, which I don't feel like is that common now as it was back in the day. I actually haven't had a patient use diaphragm, but that's something that your physician can size you for and whatnot. So diaphragm, there's a spermicidal sponge, also not that common. Spermicidal jelly is another thing that you would pair with your diaphragm or your sponge. But I would say the most reliable, with percentages closest to hormonal birth control, would be the copper IUD and a condom. And natural family planning, because those kind of all go together. All right, well, that's going to be it for this week's episode of Health Talk Tuesday. Thank you so much for tuning in. If you like the video, please like it because it helps support my channel. Please leave a comment down below, especially if you have a pressing health question that you would like me to answer in the upcoming videos. And don't forget to subscribe to my channel. You can also follow me on Instagram at Dr.Brandi_NMD. And I will see you next week. Bye.